So we can start. Okay, so till in the last video we were discussing this Masana Masika Vikasa we had discussed. Next we are discussing the same thing only, Masana Masika Garbha Vikasa, but in the modern terms. Okay, in the modern where how the development of the Garbha is happening. So we'll discuss that one. So in the Pradhama Masa, so in the first month, so the embryo will be forming. So the length of the embryo will be 4 millimeter. Okay, Pradhama Masa lembai 4 millimeter. So length is 4 millimeter size will be there, the embryo, and the weight will be 1.25 to 1.50 gram will be coming. Okay, so the length is 4 millimeter, weight of the embryo will be 1.25 to 1.50 gram. Okay, and embryo zygote से 1000 गुना बड़ा हो जाता है. So the embryo becomes 1000 times larger than zygote. Okay, so the embryo will become 1000 times larger than zygote. Then तीसरे सप्ताह में हृदय में सूक्ष्म स्पंदन प्रारंभ. So in the third week we can hear the heartbeat. Okay, so in the first month length is 4 millimeter, weight is 1.25 to 1.50 gram, and in the third week onwards we can hear the heartbeat. तंत्रिका तंत्र, पाचना तंत्र एवं वृक्कों का निर्माण प्रारंभ हो जाता है. So the nervous system. Okay, तंत्रिका तंत्र means nervous system, पाचना तंत्र digestive system, वृक्का kidney, urinary system. So these are all will be started to form in this first month. Okay, so in the second month the lembai 4 centimeter. So the length when it comes to the second month, so the embryo size height will increases by 4 millimeter. Okay, sorry, 4 centimeter. Okay, 4 centimeter. First month it was 4 millimeter, and in the second month the size the length will become increases to 4 centimeter. नाक कान व पलकों की आकृति परिलक्षित. So the shape of the nose, ear and eyelids will be started to reflecting. Okay, nose, ear and eyelids, this we can see in the second month. Then third month lambai 7 to 9 centimeter. So 7 to 9 centimeter length will be there. Bhar 20 gram. So the weight of the embryo will become 20 gram. Then swara yandra ओष्ठ एवं बंध नेत्र पलकों का निर्माण हो जाता है. स्वरा यंत्र is larynx. Okay, larynx, lip. Okay, lips. Oshta is lips. Bandha netra palaga, closed eyelids. Okay, closed eyelids. Larynx, lips and closed eyelids are formed in the third month. Okay, गर्भ निगरण व श्वसन क्रिया कर सकता है. So the fetus can perform the functions of the digestive system and respiratory system. Okay, so the fetus will be started to get the functions of the digestive system and respiratory system. ओसिफिकेशन सेंटरों का निर्माण प्रारंभ हो जाता है. So the ossification centers will be started to form in this third month. हाथ पैर की अंगुलियां स्पष्ट हो जाती है एवं ऊन पर नाखूनों का निशान बनने लगते हैं. So the fingers and the toes will become clear. Okay, हाथ पैर की अंगुलियां स्पष्ट हो जाती है, which means we can clearly see the fingers and toes. Okay, then there will be no sign of swelling. Okay, there will be no sign of swellings you can see in this time. Okay, there will be no sign of swellings on this region, and we can see clearly fingers and toes. गर्भ का लिंग स्पष्ट हो जाता है. So in the third month we can clearly we can see the sex of the fetus. If it is a male or female we can identify in the third month. Then in the fourth month what are the developments you can see? Lambai 22 centimeter. So the length of the fetus will become 22 centimeter. Bhar 240 gram. So weight will become 240 gram. गर्भ रोमों का प्रादुर्भाव. So there will be hairs will be started to forming. Okay. That hair follicles, that garbha romas, that lomacubas will be started to forming in the fourth month. Vernix caseova ka nirmana prarambha. So the vernix caseova will be begins to form in the fourth month. चेहरे की आकृति स्पष्ट हो जाती है. So the contour of the faces will become clear in this month. मादा को गर्भ स्पंदन की अनुभूति प्रारंभ. So the mother will be started to feeling the quickening movements. Okay, so in the fourth month. Then in the 5th month, the length will become 30 centimeter, weight of the fetus will become 480 gram. Fat deposition prarambha. So in this 5th month, fat deposition will be started to begin. ओतो में meconium का प्रादुर्भाव प्रारंभ. So there will be meconium will be started to appearing in the fetus. Okay, so in the 5th month meconium will be started to appearing. Then there will be fat deposition. These are all will be started to beginning in the 5th month. Then in the 6th month the length of the fetus will become 33 centimeter. Then weight will become 1 kilogram. Okay, Bauhunga pradurbhava. Eruption of the eyebrows will be there. So eyebrows will be started to occurring in the 6th month. Vrishano ki sthiti vrikkon ke sameep. So the position of the vrishana will become near to the kidney. Okay, position of the vrishana will become near to the kidney. Aankhein khol va band kar sakte hain. So the fetus can open or close the eyes. They can do it. Okay, opening and closing of the eyes, the fetus can do it in the 6th month. चिल्लाने का सामर्थ्य भी आ जाता है. So they have a ability to shout. Okay, they will gain the ability to shout in the 6th month. Then in the 7th month, the length of the fetus will become 40 centimeter, weight will become 1.5 kilogram. प्रायः सभी तंत्रिक्रिया reflex स्थापित हो जाता है. So there will be nervous reflexes will be started to occurring in the 7th month. Okay, nervous reflexes. वृषणों का inguinal canal में प्रवेश. So the वृषणा will enter into the inguinal canal. लेनगो अदृश्य होना प्रारंभ हो जाती है. So the lanugo hairs are there, they will be started to disappearing in this 7th month. फुफ्फुस परिपक्व हो जाते हैं. So the lungs will be started to mature in the 7th month. Then 8th month, the length of the fetus will become 43 centimeter, weight will become 2 kilogram. वृषण कोश में उदर जाती है. So the testis will be started to descending from the scrotum. Okay, वृषण कोश में उतर जाते हैं. So the testis will be started to descending from the scrotum. Then in the 9th month, the length of the fetus will become 47 centimeter, weight will become 2.5 kg. Then here sabhi anga pratyanga purna. So here all the parts will be completely formed in the 9th month. So these are the masana masika garbha vriddhi krama which is told in the modern topics. Then Sushruta has mentioned some of the important things. In the 3rd month, Indriyas will be forming in the Sukshma form. In the 4th month, Indriyas will be in a Pravyakta, which will be visible. In 7th month, Indriyas will become Pravyakta Taraha. Much more visibility you will be getting in the 7th month. So these 3 months is very, very important. Then Dauhrida Avastha, when the mother will be feeling the Dauhrida. So Charaka is telling it is in the 3rd month, Sushruta is telling it is happening in the 4th month, Vagbhada is telling 3 paksha se 5 maas tak. So from the 2 months, okay, 1.5 months to 5 months, this is the period where the Dauhrida will be happening. Kashyapa is telling in the 3rd month. So these are the Dauhrida according to each Acharya. Okay, so the next one is गर्भ में सर्वप्रथम उत्पत्ति. So in Charaka Samhita, in Sushruta Samhita, in Charaka Samhita what they are telling means there will be a seminar will be conducting. So in the seminar so many scholars will be there. Okay, so in that seminar there is one topic has come that in the Garbha which part will become appear first time. Okay, when the Garbha is forming, no, so the which part will be developing first time, which is asked in the seminar. So each scholars will be telling each part. So which are the parts they are telling. Okay, so Kumara Shira Bharadwaja, he is telling that Shiras is forming first of all in the Garbha. Okay, he is telling that Shira in the Garbha, the first organ which is developing is Shira, according to Kumara Shira Bharadwaja. Kangayana is telling Hridaya is the first organ which is developing. Bhadrakapya, it is telling Nabhi is the first organ. Bhadra Shonaga is telling Guda is the first organ which is developing. Then Bedisha, he is telling that Hath Pair, which means Hastapada. Okay, hand and legs are forming first of all in the fetus according to Bedisha. Vaideha Janaga is telling Indriyas are first of all forming. Mariji Kashyapa is telling Achintya will be forming first of all. But Atreya is telling all the organs are simultaneously developing. Okay, Sarvanga. Okay, this is the conclusion. So when the fetus is forming, all the organs are developing at a time. There is no one organ is developing. First of all the organs will be developing first at a time, like that Atreya has told, and they have concluded the seminar. Okay, in the same way Sushruta Samhita also there also like that description is there. So in there also Shaunaga Acharya, he has mentioned that Shiras is first of all forming. Kridavirya is telling Hridaya is forming in the Garbha first. Parashara is telling Nabi is forming in the Garbha. Then Markandeya is telling Pani Pada is first of all forming. Subhuti Gautama is telling Madhya Sharira. Okay, that Koshta Bhaga, that is the first thing which is developing in the Garbha. Then Dhanvantri concluded that Sarvanga. So all the organs are developing at a time, which is told by Dhanvantari. Okay, Sarvanga. Okay, so this is the Sarva Pradama Ulpati according to each Acharya. Next one is layers of the skin. Very, very important. Okay, according to Charaka, according to Sushruta, according to Charaka, 6 layers of skin is there. According to Sushruta, 7 layers of skin. Here, what they will be asking means the Roga they will be telling. Okay, one disease they will be mentioning, and they will ask you in which layer it is forming. That is a more common questions we used to get. So according to Charaka, the first layer is called Udagadara, second layer is called Asragdara, third layer is called Sitma Kilasa Adhishtana. Okay, so in the third layer, the Sitma Kilasa Rogas are occurring in the third layer according to Charaka. In the fourth layer, Dadru Kushta Adhishtana, Dadru and Kushta Roga is happening in the fourth layer. In the fifth layer, Allergy Vidradika Adhishtana, Allergy Vidradi skin disorders are happening in the fifth layer of the skin. And in the sixth layer, Iske Katne par तम प्रवेश व स्थूल मूल की पेडगाओं की उत्पत्ति हो जाती है. So if there is a cut is happening in the sixth layer, then what happens? Tama pravesha will be occurring, and it leads to the severe deep pedagas will be started to occurring. Okay, so the deep stula moola pedagas are occurring in the sixth layer. So that much damage is happening. If the damages happen till the sixth layer, then what happen? Very deep nodules will be developing. Okay, so these are the 6 layers of the Charaka. He has not mentioned any name for the each layer. He is telling like only for first 2 layers he has mentioned Udagadara, Asragdara. Then later onwards he is telling based on the disorder, which disorder is affecting. Okay, so in the third layer Sitma Kilasa Adhishtana. In the fourth layer Dadru Kushta Adhishtana. In the fifth layer Allergy Vidradi Adhishtana. And in the sixth layer there will be Stula Moola Pedagas will be occurring. So these are the 6 layers of skin according to Charaka. According to Sushruta, okay, 7 layers are there. Okay, Ashtanga Hridaya also mentioned 7 layers of skin. Okay, Ashtanga Hridaya, Sushruta both are telling 7 layers of skin. And this 7 layers has different names are there. Okay, so Pradama, so the first layer is called as Avabhasini, and the size of the Avabhasini is 1/18 Vrihi Pramana. Okay, 1/18 Vrihi Pramana. And what other things will be happening in the Avabhasini? It helps in the Sarva Varnava Chaya Ki Prakashaka. So the Chaya, all those things, Chaya, Varna, that complexion, all those things will be occurring in the Avabhasini. And here which are the conditions will be developing? Sitma Padma Kandaka. Okay, Sitma Padma Kandaka, these 2 conditions are arising from the Avabhasini layer. Okay, so the first layer is called Avabhasini. The size of the Avabhasini is 1/18 Vrihi Pramana. So here what other things will be happening? Chaya Varna. Okay, so this type of things will be developing in the Avabhasini layer. What are the conditions will be developing in Avabhasini? Sitma and Padma Kandaka. These are the skin condition affecting in the Avabhasini. Second layer is called as Lohida. The size of the Lohida is 1/16 Vrihi Pramana. And here which all the conditions are affecting? Tilakalaga, Nyacha, Vyenga. Okay, Tilakalaga, Nyacha, Vyenga, like moles, freckles. Okay, so this type of conditions are developing in the Lohida layer. And the third layer is called as Shveda. Okay, the size of the Shveda is 1/12 Vrihi Pramana. Okay, 1/12 Vrihi Pramana. So here what are the conditions are developing? Charmadala, Ajagalli, Mashaga. Okay, Charmadala, Ajagalli, Mashaga. These type of conditions are developing in the Shveda layer. Then, and the fourth one is Tamra. So here Tamra is 1/8 Vrihi Pramana. Okay, 1/8 Vrihi Pramana. And which are the conditions are developing here? Kilasa Kushta. Okay, Kilasa and Kushta Rogas are happening in the Tamra layer. And the fifth layer is called Vedini. So the size is 1 by 5 Vrihi Pramana. Okay, 1 by 5 Vrihi Pramana. Here also Kushta is happening. Kushta, Visarpa, Adhishtana. So Kushta Roga, it can happen in Tamra and Vedini. Okay, Tamra, Vedini, in these two layers Kushta Roga is happening. Okay, so that is very, very important. So Kilasa, Kushta, it is happening in the Tamra. Kushta, Visarpa is happening in the Vedini. Okay, so Kushta in both the layers can happen. Then in the sixth layer, that is called Rohini. So it is 1 Vrihi Pramana size. Okay, the size of the Rohini is 1 Vrihi Pramana. What are the conditions are affecting in this area? Grandhi, Apachi, Arbuda, Shlipada, Gelaganda, like tumor like conditions. Okay, Grandhi, Apachi, Arbuda, Shlipada. Shlipada, that filariasis condition. Gelaganda. Okay, there will be swelling in the ganda, like a goiter type of conditions. Okay, so this type of conditions are happening in the sixth layer, Rohini. So size of the Rohini is 1 Vrihi Pramana. Then the last seventh one is Mamsadara. So here 2 Vrihi Pramana. Okay, 2 Vrihi Pramana is seventh layer, Mamsadara. Okay, so here what are the conditions are happening? Bhagandara, Vidradi, Ashras. Okay, so in Mamsa it is Ashras is happening. No? Mamsangura is Ashras. So in that way, Ashras, Bhagandara, Vidradi, these are all happening in the Mamsadara. Vidradi means abscess formation. So that is also a deeper condition. So that is happening in the Mamsa. In that way you can remember. So in the first layer is called Avabhasini. So which are the layers? Avabhasini, Lohida, Shveda, Tamra, Vedini, Rohini, Mamsadara. So these are the 7 layers of the Twak. Okay, how the size is coming? 1 by 18, 1 by 16, 1 by 12, 8, 5, 1 Vrihi and 2 Vrihi. Okay, 1 by 18, 1 by 16, 1 by 12, 1 by 8, 1 by 5, 1 Vrihi Pramana, 2 Vrihi Pramana. Okay, so these are the main things related with the 7 layers of Twak. Very, very important. Especially with the disorder they will be asking. Like Charmadala, it is affecting in the which layer? Okay, Shlipada, which is affecting in the which layer? Kushta Roga, which is affecting in the which layer? Okay, so like that of questions only most of the time we used to get. So that is very, very important. In which all the layer the conditions are affecting is very important. Then Kushta ka Adhishtana Vedini va Tamra dono ka mana hai. So Kushta it is affecting in both Tamra and Vedini. These are the 2 locations where the Kushta Roga is affecting. Next is related with the Agada Tantra, Vishavegas. Okay, so according to Charaka, according to Susruta they have mentioned. So in the Pradama, okay, so Susruta has mentioned 7 Vegas. Charaka has mentioned 8 Vishavega. Okay, this is Stavara Vishavega. Okay, so Stavara Vishavega according to Charaka 8, according to Susruta 7. Okay, so what are the, in each Vishavega, what are the Lakshanas you will be getting? So the first Vishavega, where Charaka is telling Rasa Vigrudi is happening. Okay, Charaka is telling Rasa Dhatu is getting V-shaded. So in the first Vishavega, then in the second Vishavega, so in the second Vishavega, what is happening? Rekta Vigrudi. Okay, Rekta Vigrudi. So here Tamaga Shwasa will be getting. So in the first Vishavega, Rasadhatu is getting V-shaded, and when it is entering into the second Vishavega, Rekta is getting V-shaded and the patient will be getting Tamaga Shwasa. Okay, so Tamaga Shwasa, like you can just imagine, like you have taken the Visha, so it will mix it with the water. So Rasa is getting V-shaded, then next it will be, you will be getting breathing difficulty. So it is entering into the Rekta. When it is mixing with the blood, you will be getting breathing difficulty. So in the second Vishavega, you are getting Tamaga Shwasa. And in the third Vigrudi, in the third Vishavega, Mamsa Vigrudi, Rasa, Rekta, Mamsa. Okay, so Mamsa is getting V-shaded. So when Mamsa is getting V-shaded, so you will be getting Mandala, that you can note down, Mandala, Kandu, Shvayadu, Kota. Mandala, Kandu, Shvayadu, Kota. So these type of Lakshanas you will be getting. Okay, first of all it is getting mixed with the Rasa, then it will mixed with the Rekta, so that time breathing difficulty is getting, then this Visha will enter into the Mamsa, so that time you will be getting some skin lesions. So Mandala, Kota, Shvayadu, Kandu. So this type of lakshanas you will be getting. Okay, so you will be started to getting circle-like lesions, severe itching sensation, swelling, that type of symptoms you will be getting in the third Vishaveka. Okay, so in the fourth Vishaveka, Sarva Dosha Pragopa is happening. All the doshas are getting Koba, Vada, Pitta, Kapha, these three are getting vitiated in the fourth Vishaveka. In the fifth Vishaveka, Nila, Deenam, Tamaso. So here Tamo Darshana will be happening in the fifth Vega. This is very, very important. Okay, patient will be getting Neela Varna and Tamo Darshana will be happening in the fifth Vishaveka. Very, very important. Most of the time you will be getting question related with the Tamo Darshana. So Tamo Darshana is happening in the fifth Vishaveka. Okay, and in the sixth Vishaveka, Hikka will be generated, and in the seventh Vishaveka, Skanda Bhanga will be happening. There will be fracture will be happening in the Skanda Pradesha, and the eighth Vishaveka, here Marana will be occurring. So when the Visha is entering into the eighth Veka, so that time the death of the patient will be getting. So these are the lakshanas of the Vishavekas according to Charaka. So in the first Vishaveka, Rasa, then Rekta is getting vitiated, so breathing difficulty, Tamaga Shwasa, then it is entering into the Mamsa, then you will be getting skin lesions. Mandala, Kandu, Shvaidu, Kota, and in the fourth Vishaveka, so there will be Vada, Pitta, Kapha is getting vitiated, and in the fifth Vishaveka there will be Tamo Darshana. Okay, Neela, Deenam, Tamo Darshana. Then in the sixth Hikka, then Skanda Bhanga, then Marana. Okay, so these are the Vishaveka lakshanas according to Charaka. Okay, according to Sushruta, the first in the Pradama Vishaveka, only 7 Vishavekas he has mentioned. So in the first Vishaveka, what are the lakshanas he is telling? Jihva Shyava Varna Va Shwasaki Vilpati. So here Shwasa is getting, okay, Jihva Shyava Varna. So there will be black discoloration will be happening in the tongue. Okay, while you are taking Visha, the tongue will become black in color and suddenly you will be getting breathing difficulty. Okay, then in the second Vishaveka, what is happening? From the tongue, the Visha will enter into the Amashaya. So Amashaya mein Visha, then Vepatu. So you will be started to getting Vepatu, tremors. Okay, Sushruta is telling while taking the Visha, so the tongue will become black in color and because of the smell you are getting breathing difficulty. So like that you can just imagine. Okay, so you are taking the Visha, so the tongue will become black in color and suddenly you are getting breathing difficulty. So the Visha, then after the mouth it will reach to the Amashaya. So that time there will be trembling like a Vepatu will be getting. Then in the third Vishaveka, Talu Shosha. Okay, there will be dryness of the Talu and Tivra Amashaya Shula. Severe abdominal pain you are getting in the third Vishaveka. Okay, in the second Vishaveka, it has entered into the Amashaya. Okay, so in the third Vishaveka, you are getting severe abdominal pain. Okay, then Talu Shosha. Then in the fourth one, Hikka, Amashe, Pakvashe me Pida. So Hikka will be there. Then there will be severe discomfort in the Amashe, Pakvashaya. Then in the fifth Vishaveka, Sarvadosha Pragopa. So according to Sushruta, Sarvadosha Pragopa is happening in the fifth Vishaveka. According to Charaka, it is happening in the fourth Vishaveka. Okay. So Sarvadosha Pragopa, then Parva Bheda, Vaivarnya Darshana. Parva Bheda means you will be getting joint pain. Okay, joint pain. Then Vaivarnya Darshana. Whatever things you are seeing, that's all having different colors will be there. Then in the in the sixth Vishaveka, Tivra Adhisara. Okay, there will be severe Adhisara. So that is very, very important. Adhisara you are getting in the sixth Vishaveka. That is important. Okay. Then Buddhi va Pranonka Nash. So they will be started to reducing the intelligence, all those things. Then in the seventh Vishaveka, Skanda, Kati, Padava, Mrityu. So there will be a fracture in the Skanda and Kati and then it leads to Marana. So these are the Vishaveka lakshanas according to Sushruta. Okay, so the Jihva Shyavada Shwasa, then the Visha will enter into Amasha, so suddenly Vepatu will be there, then after that Amashaya Shula will be there, Talu Shosha will be there, then Hikka, Amashaya Pakvashaya Pida, then Sarvadosha Pragopa, Parva Bheda Vaivarnya Darshana, then Tivra Adhisara, Buddhi Prananasha, then Skanda Kadipada Mrityu. So these are the Vishaveka lakshanas according to Sushruta. So the eighth Vishaveka, that is told only by Charaka. Okay, then next is Chikilsa. Okay, so in Pradama Vishaveka, which Chikilsa we have to follow? Daha Karma, Vamana Karma according to Charaka. So first of all, according to Charaka, we'll see Daha Karma, Vamana Karma is indicated. So in the second Vishaveka, Virejana is indicated. Okay, then in the third Vishavega, Kshara Agada Pana, very very important. This one is very important. Kshara Agada Pana. Okay, then in second Vishavega, before doing Virejana, you have to do Hridaya Varana. That is very important, that you can note down. Before doing Virejana Karma, Hridaya Varana is indicated in second Vishavega. Hridaya Varana treatment has to be done. Then after that you have to do Virejana Karma in second Vishavega. In the third Vishavega, Kshara Agada Pana has indicated. So that is also important. Kshara Agada Pana, in which Vishavega is indicated. Then in the fourth Vishavega, Gomaya Rasa Kapita Madhu Prayoga. So there will be, you have to take Gomaya Rasa, the juice of the cow dung. Okay, so that should be taken, mixed with the Kapita and Madhu has to be taken. Then in the fifth Vishavega, Kakanda Shirisha Prayoga has mentioned. Kakanda or Shirisha Swarasa has to be taken in the fifth Vishavega. Okay, Kakanda or Shirisha. So these Swarasa should be used as Anjana, Nasya or Ashchodana. In these three ways you can use Kakanda or Shirisha. Okay, so in the fifth Vishavega, Kakanda Swarasa or Shirisha Swarasa has to be used. So how you have to use it? By Anjana Karam, by Anjana or by Nasya or Ashchodana. So in these three ways you can use it. Any one of the way you can use it. Then in the sixth Vishavega, Sapnya Stabana Aushada Prayoga. Okay, Sapnya Stabana Aushada Prayoga is indicated in the sixth Vishavega. Then in the seventh Vishavega, Stavarame Jangama Visha Prayoga was Sarpadashta, which means it is a Stavara Visha. Okay, so opposite of the Stavara Visha is Jangama Visha. So as a treatment you can use it. Okay, if a patient is suffering with a Stavara Visha, you can use Jangama Visha. If a patient is suffering with the Jangama Visha, then you can use Stavara Visha. Like opposite things you can use it. So in seventh, when the Visha has become reached in the seventh stage, so which Chikitsa you have to follow? Jangama Visha Chikitsa, like Sarpadashta. Okay, you can do snake bite, so that Visha will encounter the Stavara Visha. So through that way patient will recover. Okay, then Kakapada incision has mentioned. Okay, so in the seventh Vishavega, okay, Charaga has mentioned that Kakapada incision. Kakapada incision means crow leg is there, no, leg of the crow. So in that way you have to put an incision, and in that you have to keep the medicine, and through that way we can recover the patient. Kakapada incision. Okay. So in Kakapada, in that shape you have to put incision, you have to keep the medicines, and that indicated in the seventh Vishavega. That is very very important. So Kakapada, in which Vishavega it is indicated, that is also important. So Kshara Agadapana, third Vishavega, Hridayavarana in the second Vishavega, then Kakapada, that incision is putting in the seventh Vishavega. Okay, then Jangama Visha Prayoga, it is also known as Pradi Visha Prayoga. Okay, Jangama Visha, or otherwise known as Pradi Visha Prayoga, that is indicated in the seventh Vishavega. Okay, then in the eighth Vishavega, so here Palasha Bija Churna, more Pittaka Prayoga. More Pitta is Pitta of Mayura. Okay, peacock. Okay, Mayura Pitta mixed with the Palasha Bija Churna is indicated in the eighth Vishavega. So these are the Vishavega Chikitsa. Okay, so Daha Karma Vamana, then in the second Vishavega, first of all Hridayavarana, then followed by Virejana, then Kshara Agadapana, then Gomaya Rasa mixed with the Kapita Madhu, then Kakanda Swarasa, Shirisha Swarasa Prayoga, then Sapnya Stabana Aushada Prayoga, then Pradivisha Prayoga, Kakapada incision, then in the eighth Vishavega, Palasha Bija Churna mixed with the Mayura Pitta. Then Sushruta is telling in the Pradama Vishavega, Vamana Madhu Grudase Agadapana. Okay, Vamana Karma has to be done. Then Agadapana mixed with the Madhu and Sarpi has to be taken. Okay, Agadapana mixed with the Madhu and Grida. And in the second Vishavega, Vamana, Virejana Karma both are indicated. In the third Vishavega, Agadapana, Nasya Anjana. So that is important. So Nasya Anjana is indicated in the third Vishavega. Okay, then in the fourth Vishavega, Sneha Misrada Agada has to be taken. Then in the fifth Vishavega, Madhuyashti Kwada mixed with the Agada. Okay, Madhuyashti Kwada mixed with the Agada has to be taken in the fifth Vishavega. In the sixth Vishavega, Avapida Nasya is indicated. Okay, Avapida Nasya. So in the Charaka has telling Sapnya Stabaka, like to getting the consciousness. Okay, so Avapida Nasya is indicated. Then Adisara Chikitsa. Because in the sixth Vishavega we are getting Adisara, so Adisara Chikitsa plus Avapida Nasya has to be given. Then in the 7th Vishaveka, Kakapada incision is indicated in the 7th Vishaveka. So these are the Vishaveka Chikitsa according to each Acharya. Next is again diet of the Garbhini. Okay, so in the each month Garbhini, what are the things has to be eat? Okay, according to Charaka, according to Susruta. So Charaka we can see. So in the first month Charaka is telling Shidala Dugdha. Okay, here we have to take milk and the cold water. Okay, so milk and cold water is indicated in the first month. Okay, Shidala and Dugdha, these two are things we have to take. Okay, so Garbhini in the first month, what Garbhini has to take? Shidala and Dugdha, cold water, and then Dugdha, milk has to be taken. In the second month, Madhura Gana Siddha Kshira. Okay, with the Madhura Dravyas, we have to prepare Kshira. Okay, Madhura Aushadha Siddha Kshira has to be taken in the second month. Then in the third month, Doodh, Madhu, Grida. Okay, Kshira mixed with the Madhu and Grida has to be taken. Okay, so in the first month also Kshira has indicated, milk is indicated. In second month also with the Madhura Aushadha Dravyas we have to prepare Kshira. In the third month along with the Kshira, Madhu and Grida has to be taken. Okay, so first 3 months Kshira has mentioned. Okay, then in the fourth month, Doodh, Makhan ya 1 aksha pramaname makhan. Okay, so Doodh, Kshira mixed with the Navanida. Okay, Makhan is Navanida. So in the fourth month, the Garbhini, what has to be taken? Kshira mixed with the Navanida has to be taken. Navanida, how much we have to take? 1 aksha pramana. Okay, then in the fifth month, Doodh mein Grida milakar. So the Kshira and Sarpi together you have to take it in the fifth month. Okay, Kshira and Sarpi. First one is Jala and Dugdha, then Madhura Aushadha Siddha Kshira, then in the Kshira Madhu and Grida, then Kshira Navanida, then Kshira Grida. Okay, then in the sixth month, Madhura Gana say Aushadha Siddha Doodh mein Grida milakar. Okay, so Madhura Aushadhi, with that you have to prepare Kshira. Okay, Madhura Aushadha Siddha Kshira mixed with the Grida has to be taken. Okay, then in the seventh month also same thing. Madhura Gana say Aushadha Siddha Kshira mein Grida milakar. Okay, 6th and 7th same diet we have to follow. Okay, Madhura Dravyas, with that you have to prepare a Kshira. Okay, Madhura Aushadha Siddha Kshira mixed with the Grida has to be taken in 6th and 7th month. In the 8th month, Yavagu Doodh va Grida Prayoga. So in the 8th month, Yavagu Bana is indicated. So in that Kshira and Grida has to be added. Then in the 9th month, Anuvasana Basti. So the 9th month, Anuvasana Basti is indicated. So these are the diet which has to be followed by Garbhini during the each month. Okay, then Susruta. So Susruta, he has mentioned that 1 to 3 months. Okay, 1 to 3 months, same diet he has mentioned. Okay, Madhura Shida Drava Ahara. Okay, according to Susruta, 1 to 3 months, the same diet we have to follow. Madhura Shida Drava Ahara should be taken. Then 4th month onwards, he has changed the diet. Payo Navanida Samsrishta Ahara ya Jangala Mamsa Yukta Ahara. Okay, Payo Navanida, which means this Dhadi. Okay, Dhadi mixed with the rice you have to take it. Rice and Dhadi. Okay, Payo Navanida Samsrishta Ahara, which means the food in that we have to add Dhadi. With that you have to take the diet, or otherwise Jangala Mamsa Yukta Ahara, the Anna which is processed with the Jangala Mamsa. Okay, so in the 4th month, rice plus Dhadi has to be taken, or otherwise Jangala Mamsa plus rice has to be taken in the 4th month. Then in the 5th month, Doodh mein Grida milaka. So Kshira mixed with the Grida has to be taken. Kshira Sarpi. Then in the 6th month, very very important. Most of the time we used to get questions related with the 6th and 7th month. In the 6th month, he has told Shvadamshtra Siddha Yavagu Prayoga. Okay, Shvadamshtra means Gokshura. Okay, so Shvadamshtra Siddha Yavagu has to be prepared in the 6th month. And in the 7th month, Pradak Parani Siddha Grida Prayoga. Okay, Pradak Parani. Okay, with that you have to prepare Grida, that you have to take it in the 7th month. So 6th month is Shvadamshtra Siddha Yavagu, 7th month is Prudak Parani Siddha Grida. Okay, then in the 8th month, Bhadrodaga Kwadase Astabana Basti, Tadanandar Madhura Ganava Dugdase Anuvasana Basti. So Sushruta has mentioned in the 8th month Astabana Anuvasana Basti. So in the Astabana Basti, which one we have to use? Bhadrodaga Kashaya. For Anuvasana, Madhura Gana Aushada Siddha Kshira has to be taken. It is not Kshira, it is Taila. Okay, Madragana Siddha Taila has to be taken in the taken as Anuvasana Basti. Okay, so in the 8th month, Astavana Anuvasana Basti is indicated by Sushruta. So the diet of the Garbhini according to Sushruta 1 to 3 months is Madhura Shida Drava Ahara. Then in the 4th month, Ahara which mixed with the Dadi or Ahara mixed with the Jangala Mamsa has to be taken. And in the 5th month, Kshira Sarpi has to be taken. And 6th and 7th is very very important. Shvadamshtra Siddha Yavagu Pradak Parni Siddha Grida. Then in the 8th month, Astavana Anuvasana Basti is indicated. Okay, so these are the diet which is recommended by Sushruta for Garbhini. Next one is Srodo Moola we are going to discuss. According to Charaka, 13 Srodas. Here what they are Srodas, they are telling Andarmukha Srodas. Okay, the Srodas which is present inside our body. Andarmukha Srodas they are discussing here. Okay, so Andarmukha Srodas according to Charaka 13. Okay, according to Charaka and according to Vakbhata, both are telling 13 Srodas. According to Sushruta, it is 11 pairs. Okay, 11 pairs. 11 pairs or otherwise 22 in number will be coming. Okay, 11 pairs of Srodas according to Sushruta. Okay, Andarmukha Srodas according to Charaka and Vakbhata 13. Okay, according to Sushruta 11 pairs. Okay, so Vakbhata, he has given a name for Srodas, that is called Jividayana. Okay, another name of Srodas is Jividayana. Okay, so what are the Srodas? Okay, so here you can see Prana Udaga Anna, then Rasa Rekta Mamsa Meda Asti Majja Shukra. Okay, Saptadadus will be coming. So first of all, Prana Udaga Anna, then Saptadadu, Rasa Rekta Mamsa Meda Asti Majja Shukra. Then the waste, that Malas, Mutra Sveda Purisha. Okay, Mutra Sveda Purisha. So this will be coming the 13 Srodas according to Charaka, according to Vakbhata. Okay, Prana Udaga Anna, then Saptadadu, Resarekta Mamsa Meda, Asti Majja Shukra, then Trimala, Mutra, Sveda Purisha. Okay, so this will be coming the 13 Shrodas. So Sushruta has not accepted Asti Majja Svedavaha Shrodas. Okay, Asti, Majja, Svedavaha Shrodas, these three are not accepted by Sushruta. Instead of that, he has added one Shrodas, that is Artavavaha Shrodas. So Artavavaha Shrodas is told by Sushruta. Okay, so this is the detail of the Shrodas. So Shrodas is according to Charaka and Vakbhata 13, according to Sushruta 11. Sushruta, which other things are not accepted? Asti, Majja and Svedavaha Shrodas. Instead of that, one Shrodas additionally he has added, that is Artavavaha Shrodas. Okay, so next we will be seeing the Srodo Moola. Okay, which are the Srodo Moola? According to Charaka's version, we will see Pranavaha Srodo Moola is Hridayam and Mahashrodas. Okay, Hridayam and Mahashrodas. Udagavaha Shrodo Moola is Talu Moola and Kloma. Okay, Talu Moola and Kloma is the Udava Shrodo Moola. Then Annava Shrodo Moola is Amashayo Moolam Vamamcha Pashva. Okay, Amashya and Vama Pashva. These are the Moolasthana of Annavaha Shrodas. Okay, almost same for Sushruta also. Okay, you can see here Sushruta's Pranavaha Shroda Moola is Hridaya, but instead of Mahashrodas he has mentioned Rasavahini Damani. Okay, Hridaya and Rasavahini Damani is the Moolasthana of Pranavaha Shrodas. Udagavaha is same for both of them, Talu Moolam Klomam. Annavaha also same only, Amasha Annavahinishcha Damanyaha. So Amasha and Annavahini Damani, these are the Moolasthana of Annavaha Shrodas. Okay, so Pranava Shrodas instead of Mahashrodas, Sushruta has mentioned Rasavahini Damani. Then Rasavaha Shrodo Moolasthana according to Charaka Hridayam Moolam Dasha Damanyaha. Okay, Dashadhamani is the Moolasthana. According to Sushruta, Hridayam Rasavahinyashcha Dhamani. So Prana Rasa both are having same Moolasthanas. Okay, Hridayam Rasavahinyashcha Dhamanyaha. Charaka is mentioned as Dashadhamani. Okay, then Rektavaha Shrodha Moolasthana Yakrit Pliha. Both are telling Yakrit Pliha. Additionally, Sushruta is mentioned Rektavahinyashcha Dhamanyaha. Then Mamsava Shrodha Moola, according to Charaka, Snayu Moolam Twakcha. Okay, Snayu and Twak. These are the two Moolasthana of Mamsava Shrodhas. Sushruta additionally is adding Rektavahini Dhamani. Snayu Twak Rektavahinishcha Dhamani. So Rektavahini Dhamani is a Moolasthana of Rektavaha Shrodhas and Mamsavaha Shrodhas. Then Medo Vahashrodhas Moolasthana is Vrikko Moolam Vapavahana, Vrikka and Vapavahana. But exactly another thing which is told by Sushruta, Kati and Vrikka. Okay, Kati and Vrikka is told by Sushruta. Astivaha Shrodhas is told only by Charaka. So Medo Moolam Jaganamsha. So Meda and Jagana is the Moolasthana. Majjavaha Shrodhas Astini Moolam Sandeshcha. So Asti and Sandhi is the Moolasthana for Majjavaha Shrodhas. So these two are not mentioned by Sushruta. Shukravaha Shrodha Moolasthana is Vrishano Moolam Shefascha. Okay, Vrishana and Shefa, these are the two Moolasthana of Shukravaha Shrodhas. Sushruta is telling Stana and Vrishana. Then Mutravaha Shrodhas Moolasthana is Bastir Moolam Mangshanaucha. So Sushruta has mentioned Basti Medram. Then Svedavaha Shrodhas, it is told only by Charaka. So Medo Moolam Loma Kubascha. Okay, Meda and Roma Kuba, these are the Moolasthana of Svedavaha Shrodhas. Then Purishavaha Shrodhas Pakwashya or Moolam Stula Guda. Okay, Pakwasha and Stula Guda, these are the locations of the Purishavaha Shrodhas. According to Sushruta, Pakwashya Gudam. Artavaha Shrodhas, that is mentioned only by Sushruta. So Artavaha Shrodha Moolasthana is Garbhashaya Artava Vahinyashcha Dhamanyaha. So Garbhashaya, then Artavahini Dhamani, these are the two Moolasthana of Artavaha Shrodhas. So these are the Shrodhas and their Moolasthana according to each Acharya. Next one is Srodha with the Lakshana. Okay, like if anything happens to these Srodhas, what are the conditions will be generated? So Pranava Srodhas, if anything happens to Pranava Srodhas, Akroshana, Vinamana, Mohana, Vepana, Marana has to be occurred. Okay, this is according to Sushruta. Okay, according to Sushruta, Akroshana, Vinamana, Mohana, Vepana and Marana will be occurring in the Pranavaha Srodha Dushti. In Annavaha Srodhas, if anything happen, then Atmana, Shula, Annadvesha, Chardi, Pipasa, Andhya, Maranam cha. So Marana is getting Pranavaha Srodhas, then Annavaha Srodhas. Then Udagavaha Srodhas, Pipasa, Sadhyo Maranam cha. Okay, so in Udagavaha Srodhas you are getting Sadhyo Marana, immediate death. Okay, if anything happens to Udagavaha Srodhas, immediate death will be happening, but Prana Anna Marana will be later, you will be getting some of the Lakshanas, then later only the death will be happening. Okay, so Sadhya Marana is happening in the Udagavaha Srodhas. Okay, then Rasavaha Srodha with the Lakshana. Pranavaha Viddavat Maranam Tat Lingani. So what are the Pranava Srodha with the Lakshana? The same thing is happening in the Rasavaha Srodhas. Okay, then Rektava Srodho Dushti. So in Rektava Srodhas is getting Vishari, then what are the Lakshanas? You will be getting Shyava Angada, Jwara Daha Panduda, Shonida Gamanam, Rekta Netrada. Okay, so there will be a blackish discoloration. Shyava Varnada will be happening to the body. Fever will be there. Daha, burning sensation. Panduda, there will be paleness will be there. Shonida Gamana, there will be excessive bleeding will be there. And eyes will become red in color. Okay, Rekta Netrada. These are all you can see in the Rektava Srodho Dushti. Mamsava Srodho Dushti, Shvayadur Mamsa Shosha Siragrandhi Maranamcha. So Siragrandhi. Okay, varicose vein type of condition. So Siragrandhi is happening in the Mamsava Srodho Dushti. Here also Marana is happening. The death of the patient can happen. Then Medo Vaha Srodho Dushti Sveda Gamanam. Okay, there will be excessive sweating will be there. Snigdangada, there will be moistness will be there in the body. Talu Shosha. Because of excessive sweating, dehydration getting. So dryness of the palate will be there. Stulada Shofa Pipasa. So the body will become like severe edema will be getting, and because of that obesity will be feeling. Okay, Stulada, Shofa, Pipasa. Here also Pipasa you are getting. So Pipasa you are getting Lakshana in Medavaha Srodho Dushti, Udagavaha Srodho Dushti, Annavaha Srodho Dushti. Okay, Anna, Udaga, Medavaha Srodho Dushti. In these three things we are getting Pipasa. Sadhyo Marana we are getting in Udagavaha Srodho Dushti. Okay, Sira Grandhi you are getting in the Mamsavaha Srodho Dushti. Okay, then Mutrava Srodho Dushti, Anadda Vastida, Mutra Nirodha Stabda Metrada. So there will be difficulty in the bladder, urinary part. Then Purishavaha Srodho Dushti, Anaha Durgandada Gredidandrata. Then Shukrava Srodho Dushti, Klebada. So there will be infertility will be there. Chirad Prasego, Rekta Shukrada. Chirad Prasego, delayed ejaculation will be there. Then erecta shukrada, there will be mixed blood mixed semen will be getting, blood mixed shukra will be getting. So these are the lakshanas of the shukrava shrodho dushti. Then artava shrodho dushti, vandyatvam, maiduna asahishnatvam, artava nashascha. So there will be vandyatva, infertility will be getting, maiduna asahishnatvam. So there will be difficulty to do the maiduna. Then artava nasha, there will be amenorrhea type of conditions will be developing if there is anything happens to artava shrodha. So these are the shrodho dushti lakshanas of the each Shrodhas. So in that you can see Rakta Vahini, Damani, Moola, that is coming in the two things, Raktava Shrodhas and Mamsava Shrodhas. Okay, so in Raktava Shrodha Moola, Mamsava Shrodha Moola, Rakta Vahini, Damani is Moola of Raktava Shrodhas and Mamsava Shrodhas. Then Pipasa, the Pipasa lakshana in which all the Shrodha Dushti you will be getting Anna, Udaga, Medo, Vaha, Shrodho Dushti. Then Marana, okay, Marana in which all the conditions you are getting Prana, Anna, in Udaga you are getting Satyo Marana, then Rasa, Mamsa, Dushti. Okay, Prana, Anna, Rasa, Mamsa, Dushti, in these four Shrodho Dushti, Marana you are getting. Okay, then Sadhyo Marana is getting in the Udakavaha Shrodho Dushti. Then Andada, okay, blindness, that is getting in the Annavaha Shrodho Dushti. Because if you are not eating properly, you are not starving for so many days, then suddenly you will be getting blindness. Okay, like blindness, you don't see anything properly. So Andya Lakshana is you will getting in Annavaha Shrodho Dushti. Then Atmana, that you can see in the Annavaha Shrodho Dushti. Anaha you are getting in Purishavaha Shrodho Dushti. Okay, so Atmana, Annavaha Shrodho Dushti, Anaha, Purishavaha Shrodho Dushti. Then Shrodho Dushti Karana, reasons for getting Shrodho Dushti according to Charaka. Okay, so Pranava Shrodha Dushti, how it is happening, that is due to the Dadukshaya, Vegadharana, Vyayama Kshudidasya. So excessive Vyayama. So these are the reasons for getting Pranavaha Shrodha Dushti. Then Udakava Shrodha Dushti is happening because of the Adishushka Anna Sevana, Madirapana. Okay, so excessive dry food items if you are eating, then excessive drinking, okay, alcohol drinking, these are all will lead to Udakavaha Shrodho Dushti. Then Rasava Shrodho Dushti is happening because of Guru Ahara, Chindyanam cha Adi Chindanat. Okay, so Guru Ahara, excessive heaviness, heavy type of food items you are eating, then excessive thinking, okay, anxiety, stress, these are all will lead to Rasavaha Shrodho Dushti. Then Raktava Shrodha Dushti is happening because of the Vidahi Annapana, excessive Vidahi creating type of Annapana if you are eating, it can lead to Raktava Shrodha Dushti. Then Mamsava Shrodha Dushti is happening because of the Bhuktvacha Swapadam Diva, like after the food intake you are sleeping, okay, daytime sleep. Okay, so Diva Sapna, after eating immediately if you are sleeping for a long time, it can lead to Mamsava Shrodho Dushti. Medava Shrodho Dushti is happening because of the Bhayat, Varunyam cha Adisevanat, Avyayama, Ativyayama. So Medava Shrodho Dushti is happening because of the fear, okay, Bhaya, excessive fear, or due to the excessive intake of Varuni Madhya, or because of the Avyayama, which means no physical exercise, or otherwise excessive physical exercise. Okay, Avyayama, no physical exercise, Adivyayama, excessive physical exercise, both will lead to Medovaha Shrodho Dushti. Then Majjavaha Shrodho Dushti is happening because of the Adada Viruddhanam cha Sevana, like Ajirna or Viruddhahara Sevana, it leads to Majjavaha Shrodho Dushti. Then Astiva Shrodho Dushti is happening because of the Samkshobha Vyayama, like a trauma and Vyayama, these are all will lead to Astivaha Shrodho Dushti. Shukrava Shrodho Dushti is happening because of the Veka Avarodha Shastrakshara Agni, okay, like Vegadharana, then Shastrakshara Agni Prayoga, like excessive Shastrakshara Agni Prayoga, it can lead to Shukrava Shrodho Dushti. Then Mutrava Shrodho Dushti is happening because of the Vegadharana. Then Purishava Shrodho Dushti is happening because of the Vegadharana, Adyashana, Aktishana, okay, excessive intake of food. excessive intake of food, irregular intake of food, these are all will lead to Purishavaha Srododushti. Then Svedavaha Srododushti is happening because of the Vyayama, Ati Atapa, Krodha, Shoka, Bhaya. So exercise, then excessive sunlight exposure, then anger, okay, excessive anger, excessive depression, excessive fear, these are all will lead to Svedavaha Srododushti. Then Srodho Dushti Chigilsa according to Charaka. Pranava Srodho Dushti, here Shwasa Chigilsa we have to follow. Udagava Srodho Dushti, Trishna Chigilsa we have to follow. Annava Srodho Dushti, Amadosha Chigilsa. Mutrava Srodho Dushti, Mutra Krichra Chigilsa. Malavaha Srodho Dushti, Adisara Chigilsa. Svedavaha Srodho Dushti, Jwara Chigilsa has to be followed in the Srodho Dushti Chigilsa. Next one is Andar Vidradi. Okay, Andar Vidradi locations has mentioned. According to Charaka, 10 location he has mentioned. According to Susruta, it is 9 locations. Okay. Sorry, according to Charaga 9, according to Susruta 10, this Andar Vidradi Sthana has mentioned. So we can see in Hridaya, Andar Vidradi is happening. What are the Lakshanas you will be getting? Dhadkan, Tamaka Shwasa, Kasa. Dhadkan means palpitation. Okay, so palpitations will be getting Tamaka Shwasa, Kasa. These are the conditions will be developing if Vidradi is happening in the Hridaya. Then if Vidradi is happening in the Kloma, then Pipasa, Gala, Graha will be there. Okay, so excessive thirst, there will be problems in the throat region you will be getting. Then you have getting Vidradi in the Yakrit, then Shwasa Vriddhi. Then if you are getting Vidradi in the Pliha, Uchvasame Vriddhi. Okay, so there will be increase in the Uchvasa, like inhalation will become increases. Okay, sorry, exhalation. Okay, exhalation. Increase in the exhalation you can see if you are getting Vidradi in the Pliha. Increased breathing you are getting in the Yakrit. Okay, Andar Vidradi means like abscess formation. Okay, if you are getting an abscess in the internal organ, what are the Lakshanas? If it is happening in the Yakrit, Shwasa Vriddhi, increase in the breathing. If it is happening in the Pliha, increase in exhalation, Uchvasa Vriddhi. Then if it is happening in the Udara, Parshva Skanda Shula will be there. Then if it is happening in the Vrika, Parshva Prishta Katigraha will be there. Then in the Nabi, Hikka will be getting. So this Andar Vidradi Lakshana is very, very important. Okay, so in the Nabi Pradesh, if you are getting Vidradi, Hikka will be getting. In Vangshan, if you are getting Vidradi, Pyrome Avasad. So there will be depression in the leg will be getting. Okay, depression in the leg. Then if you are getting Vidradi in the Mutra Ashaya, Mutra Krichra, Mutra Pravritti, like excessive urination or otherwise Mutra Krichra, there will be difficulty in urination will be there. Then according to Susruta, okay, so if it is a Vidradi is happening in the Hridaya, then Hridaya mein Jagadahat, like there will be tightness will be feeling. Okay, tightness in the Hridaya Pradesha. If you are getting Vidradi in the Kloma, Shwasa, Pipasa, Adikya, so there will be breathing difficulty, then excessive thirst will be there. In Yakrit, Shwasa, Pipasa, both will be happening. So Shwasa Roga, Pipasa, both you will get if Vidradi is happening in the Yakrit Pradesha. If it is happening in the Pliha, Uchvasa, Avaroda, like there will be obstruction in the exhalation, like asphyxiation type of features will be getting. Then in Udara, if you are getting Vidradi, Vada Prakopa. If you are getting Vidradi in Vrika, Pashva Sangoja. If you are getting Vidradi in Vrika, in Nabhi, Hikka, Atopa. If you are getting Vidradi in Vangshana, Pashva, Prishta, Katigraha will be there. Then in Mutrashi, if you are getting Vidradi, Mutra Avaroda, there will be difficulty in urination will be there. In Guda, if you are getting this Vidradi, then Vada Avarodha. Okay, so there will be obstruction to the Vada dosha. So these are the Lakshanas. So this is also very, very important. Okay, so under Vidradi Lakshana, in each place Vidradi is getting, then what are the conditions will be getting in your body. Okay, so rest of the pages we'll discuss in the next video.